why fix this at all with a plate or a nail? And what do we know about this case in this 63-year-old with what's effectively a 3-part fracture? We know a few things. This population across the board in the literature has a high risk at minimum of osteopenia and certainly osteoporosis. So that's a risk factor working against us. We know that even with an anatomic reduction, the risk for post-traumatic OA and progression to needing an arthroplasty from 63 to 10 years later to 73 is really quite high. And I think both presenters indicate that while you can move these relatively early, there's some inherent delayed use, even pain-related inhibition to this procedure that does limit the ability to move, particularly in compromised bone, with a very different approach than what a reverse shoulder arthroplasty can allow, even in the setting of a fracture with tuberosity fixation that's robust. And finally, the risk of stiffness or non-union or hardware failure or as Jay pointed out, cut through of the screws through osteoporotic bone is not insignificant. And whether that's a nail or a plate, self-reported with all of those studies, it's lived somewhere between 20 to 40%. What's also clear is it's often a common argument to say, well, we'll fix this, and what's the harm? We'll just convert this to a reverse shoulder arthroplasty later. That gives us another option. But that argument is somewhat flawed, and I'll try to show some literature about what that results in terms of the outcome and in both in range of motion, but also our PROs. So I would argue that reverse shoulder arthroplasty, particularly in this age group, can yield excellent functional outcomes. And it's not just forward elevation. If you achieve tuberosity union, it can preserve every bit as much of that external rotation. It can allow for early mobilization and function, certainly more so than patients with osteoporotic fractures that are fixed. Tuberosity repair is the key with this operation, but I would argue it's the key with any of these operations, nail or plate, and that can be done very effectively with new literature supporting not just tuberosity to tuberosity fixation, but fixation with stem-based techniques, which are very robust with arthroplasty.